Welcome. In this deep dive, we're getting straight into something quite specific today, how therapists develop professional resilience.
That's right. And we're drawing from one person's really impactful experience, actually, working in Cambodia. It taught them a lot about, well, boundaries and staying afloat emotionally.
Yeah, and this source really highlights the stark contrast they felt.
It really does. It's quite powerful. They describe themselves as, white, privileged, safe home, loving parents, education, all the things we might take for granted.
Right.
And then being confronted daily with people living in a slum, dealing with parents lost to AIDS, or having HIV themselves,
Yeah.
even seeing like a 13-year-old having to navigate a world where sex work and drug use were just visible everyday
That
things.
kind of intense contrast.
Yeah,
It sounds like that was the real catalyst, wasn't it? More than just, say, a difficult case back home.
I think so. It seems it was that sheer gulf between their own life and what they were witnessing. It wasn't abstract hardship. It was visceral right there.
And it sounds like it forced a kind of reckoning.
Exactly, a reckoning with privilege, but also with the limits of what one person can actually fix. And that, maybe counterintuitively, seems to be where the resilience started to build.
Interesting. So not being able to fix it was actually foundational.
In a way, yes, it led to finding other ways to be helpful, and they got some very concrete advice from a supervisor, too.
Oh, yeah. Like what?
Well, two main things stood out. Keep case notes brief. Don't get lost in recounting every detail.
Okay, keep it concise.
Right. And the other was reflective art making.
Reflective art making. Tell me more about that. What does that actually involve?
It could be anything, really. Drawing, maybe journaling, painting, just using a nonverbal way to sort of process the feelings that come up.
So getting it out without necessarily having to put words to it straight away.
Precisely. It creates a bit of space, a different way to engage with the emotional weight of the work.
And that helps shift their understanding of their role.
Definitely. It supported this move away from seeing themselves as the fixer.
Right. The idea that the therapist comes in and solves the problem.
Yeah, away from that and more towards simply offering a safe, compassionate, real, and authentic space.
Okay, so the focus shifts to empowering the client.
Exactly. It puts the agency back with the client. The therapist facilitates, holds the space, but doesn't take over.
Which must also take some pressure off the therapist too, I imagine.
It does. And the source mentions this becoming less of an intellectual idea and more of a felt sense, something embodied.
Embodied.
Yeah.
So it's like your body learns the boundary. How does that actually happen? Is it just time?
Time, practice, and crucially, self-awareness. It's about constantly keeping track of our own internal states.
So really paying attention to yourself while you're sitting with someone else's sadness, grief, and trauma.
Yes. You have to monitor your own well-being, notice when you're starting to feel overwhelmed or take things on too personally.
And the goal is what the source calls the skill, to witness and hold space without absorbing or taking on their pain.
That's the core of it, really. That's the skill that allows therapists or anyone in a helping role to do this work long-term without burning out. Empathy, yes, but with boundaries.
It's a fine line, isn't it?
A very fine line. Requires constant, vigilant self-care.
Okay, so let's bring this together. This deep dive really showed how these sometimes quite jarring early experiences can forge that ability to set boundaries.
Right, and the value of having practical tools like that reflective art making for managing the emotional side.
And also that really key shift in understanding the role, not fixer, but facilitator, offering space.
Exactly, and that leaves us, and you, listening, with a thought, perhaps?
Yeah.
Well, how can these ideas apply more broadly, outside of formal therapy, if you're supporting a friend or a colleague or family through tough times?
How do you offer that support, that compassion?
Without absorbing all the pain yourself. How do you maintain your own well-being while still being present for others? It's something we're thinking about, isn't it?